Hi everyone, my name is Erika Arteaga and I am the Network of Environment Coordinator in the Latin American Social Medicine Association and part of the People's Health Movement in Latin America. I'm going to read my criteria because English is only my second language and it's easier like this. These are hard times. I was telling Natalie that I needed 1 day of mourning before sending this video, since Ecuador, which has been a peaceful country with no involvement in the Colombian conflict, could be involved in narco-state politics after 3 Ecuadorian journalists were killed last week in the frontier. Global perspectives for healthier lives could not ignore the lives in Syria and the lives we could lose later with a recrudescence of fundamentalism in Arab countries and beyond. These are issues that impact health. Healthier lives will be achieved with sovereignty of nations and with stopping the world depredation and need for oil. The report included Ecuador as a neoliberal alternative. I would only cite some examples: rejecting illegitimate debt, challenging the use of tax havens, raising tariffs on imports, renegotiating all contracts to increase government revenue, investing in health and education, raising minimum wage. Lessons learned from Ecuador are that these achievements could never be an accomplishment of one man single-handedly. Ecuador did this with strong social movements that during the 90s were able to stop the free trade agreement with the US signature and the privatization of our social security. During the past decade and under a progressive government, we signed a free trade agreement with the European Union, thus needing to change our constitution that we drafted in 2008. And the social security system now is under threat, as an International Labour Organization's report confirmed nowadays. We have money to cover pensions only to 2021. In any case, what we had during Rafael Correa's Delgado government was a good foreign communications campaign with a left-wing discourse. The model of accumulation had not changed. Braille explained this transition as neo-productivism with governance, which include a redistributive transition in the name of a nationalist, neo-developmentalist, limited spaces of sovereignty, and instead of neoconservative hegemony, a techno-bureaucratic hegemony, but with criminalization of social movements. These included state modernization with limited redistribution of the remnants of profits. These profits include oil profits due to the high prices of commodities during the first 3 years of the Alianza País government. This means that health services were highly funded, health infrastructure built, number of health attentions, medical attentions raised exponentially, solidifying an industrial medical model, an industrial medical complex. The medical attentions delivered and financed by the oil surplus were supposed to bring us health. But the impact of oil spills in territory, mining industries, appropriation of indigenous territories, intensive agriculture and use of agritoxins, etc., are counterproductive for health in that these extractive industries were supposed to finance. 10 years of investment in the health sector has left us without any significant change in health indicators. Maternal mortality was not reduced, infant desnutrition, malnourishment continued the trend, and inequities among poor people and indigenous ethnic groups persisted, inequities in health. What we had was a populist government that built infrastructure and benefited big pharma, contracts for construction of buildings, number of vaccines delivered, the number of vaccines increased, the vaccine industry, but not the coverage of the vaccines. Instead of strengthening health promotion and health prevention, the strengthening of the medicalization of health and thus warranting votes has not impacted the Ecuadorian population for better health results. Nevertheless, this is not to say that Ecuador has not proposed or has contributions for health as an alternative policy. Ecuador has three main contributions for alternative policies. One of these, and very important, is Summa Causae. Summa Causae is good living, it's translation from Quechua, but this is not the same as the welfare state. The conception of good living is based on indigenous peoples' worldview, which is a resistance to neoliberalism, individualism, and separation of nature. Actually, Noam Chomsky just described indigenous people and local environmental struggles as they are the hope for the world to not be submerged in climate destruction. So, Summa Causae views not humans as individuals with extreme freedom to consume, but humans tied to nature, humans as part of nature, and in this an external and reciprocity and sacred reciprocity. This worldview is not so different from the worldview of peasants, very tied to land, not big corporate agribusiness, but people tied to land, or from the pagan traditions in Europe or Wiccan knowledge. Another contribution is the indigenous movements, struggles, and organization. A recent study conducted in Brazil challenged this notion that forests or the Brazilian and also the Latin American, South American Amazon region could be kept only by conservation efforts. Conservation meaning no man allowed in the nature. Actually, the woods that remained more sustainable were woods or forests that were under indigenous tribes management. So indigenous movements and indigenous movement proposal and struggles for nature are a great source for alternative policies. Free trade agreements were stopped under neoliberal governments, but we ended signing a free trade agreement with the free European Union when more than 800 indigenous and people from labor movement, labor unions were criminalized in this government. So one lesson learned is that democracy is sustained by the organization, not by the individual, not by the citizen per se. So the citizen revolution of individual citizens does not strengthen democracy as much as organizations. The last lesson that I want to share with you is that estatism, which means the big state, huge state, does not guarantee equality, inequity reduction, or a more fair world. This means that yes, we want more funds for the public sector, and I totally hope that you get more funds for the NHS. But the state needs to be tied to public institutions for the public, accountable to the public. Otherwise, strong states, as demonstrated by the Ecuadorian case and privatization of health studies that we've conducted during the past decade, could be used to strengthen capital and capital accumulation. Because it is the use of the state apparatus and not the size of the state that ensures redistribution. Neoliberal alternative policies could only be achieved with strong social movements without persecuting indigenous peoples and social leaders, building collective instead of individual resistance, because the individual that is avid for consumption is what the neoliberal world needs. So I hope this helps. These are few reflections that we've made through the years with the Latin American Medical Association in Ecuador and the People's Health Movement. And I am very eager to hear questions during the question and answer period. Thank you.